Now, they serve as the crucial first point of contact in communities, providing essential basic healthcare and health education at the household level. Now, for years, community health promoters have powered primary care by addressing key barriers such as lack of information, distance, and cost that often prevent timely care. On this episode of Health Digest, Gloria Milemu takes a look at how these kind of healthcare workers are helping bridge the referral services gap in Nairobi's underserved urban areas like Kamkunji and Madaraka sub-counties. Take a look.
Caleb Abayo is one of Kenya's 107,831 community health promoters. The services they offer in the communities they serve is basically a lifeline, connecting households, especially in underserved areas, to formal health systems. It is yet another day when he gets to hit the dusty roads of Nairobi's Kaloleni estate. A routine he has done for the past 27 months, not out of obligation, but because the residents here depend on it. We tag along in today's visit to get a front row seat of how he delivers healthcare services. As he navigates the alleys of the tin-roofed houses, he makes his first stop of the 33 households he targets to reach every month in this area. Inside his big red bag that has all the essential items he requires to cater for his clients is a blood pressure monitor that he pulls out in order to check his client's blood pressure. Thereafter, the attention shifts to the youngest member of this household, a 6-month-old baby. Her nutritional status is among the crucial checks that must tick the box for this unsung hero who has become a lifeline for this community. Once he is satisfied with the health status of this household, he sets out for the next.
Hapo pale nimetoka, sasa nilikuwa tukuje kuona mama ambaye ako na mtoto wa miezi 6. So hapo nimefanya kwa kupima mtoto, nione temperature mtoto iko namna gani.
In such underserved communities, healthcare begins with a knock on the door. And for years, the CHPs have arrived on foot, carrying more than just a kit. They bring with them information, break distance barriers and cost of treatment that have often prevented timely care.
Households zangu zote ziko 140. Na saa zingine pia tunaweza pata ya kwamba zile manyumba ambazo ziko na wajawazito ama watoto huwa tunaweza watembelea hata baada ya miezi wiki mbili.
CHPs like Abayo are not just the first responders. They are the foundational link between households and the formal healthcare system. Even so, lack of knowledge on this critical facet of primary care, however, can be detrimental to the health of the communities they serve.
So what we are lacking was proper referral system, training on referral system. There were also issues to do with gaps in terms of training. They require training on MCH packages for identification of both the danger signs for both the mother and the baby, and proper referrals.
They say that effective referral systems from the community to the healthcare facility are essential to save lives and ensure quality and continuum of care.
We have trained 200 CHPs, 100 in Makadara and 100 in Kamukunji. That is basically strengthening referral from the community to facility and facility back to community.
So with that, we have increased skilled birth attendants. So the clients are coming to deliver within the facility and not at home.
Health experts argue that barriers and enablers of referral systems shape both healthcare system functionality and continuity of care. Addressing these common barriers like knowledge gap among CHPs, they advise, is critical in improving health at community level.
I can say each CHP is able to visit the 100 household required for every 3 months. And aside that, we normally have quarterly review meeting with them every 3 months, so that helps us to determine if really they visited those households.
Community health promoters are considered a central pillar of primary healthcare in Kenya. They are the foundation of Kenya's health system, and strengthening their skills, according to health experts, will go a long way in ensuring the realization of universal health coverage.
There was low coverage of the common childhood diseases treatment, where now we'll be able to empower the CHPs together with the clinicians through the integrated management of common childhood illnesses to be able to offer quality care. But we've seen a significant drop where in 2025 there are only three deaths that have been reported. And for neonatal deaths, again, in 2024, they were close to 441, but now this number has reduced to close to half of it, where we are seeing around 220 neonatal deaths that have been recorded.
In underserved urban areas like Makadara and Kamukunji in Nairobi County, the impact of this cadre of healthcare workers remains vivid. Each household visit, each test, and each referral now seemingly brings these sub-counties a step closer to achieving universal health coverage. Gloria Milimu, KTN.